Good, great. Well, it is noon, so we will go ahead and get started. My name is Angela Hobson, and I serve as the Associate Dean for Public Health here at the Brown School, and it is my absolute honor and delight to welcome all of you to our October installment of Public Health Speaker Series and to introduce our guest today. I know that some students have class until 12, so they'll be coming in or joining us on Zoom. Thank you for those of us who are, or those of you who are joining us online. And I know some students have class at 1 o'clock, so please, if you are finding yourself a little pressed for time, please make yourself, be sure to get in class on time. So if you need to leave a few minutes early, please be sure to do that at the end. So with that, I want to also thank Here and Next, our strategic plan at the university, for co-sponsoring this talk. We're really excited. I'm not sure if you all know this, but we have a really important election coming up. I'm sure you're all very well aware of that. So this talk could not be more timely and relevant. We're so excited to welcome our good friend and colleague, Tim Leshan, here today. Tim leads the Association of Schools and Programs of Public Health's public affairs and advocacy efforts. This includes internal and external communications, advocacy for academic public health, that's us, so he does a lot of advocacy for us and how we do our work, global affairs and fundraising. ASPPH is the leading voice for academic public health with members from around the US and the globe. Tim takes a proactive approach that has resulted in the development of reports on gun violence prevention, the impact ASPPH members made during the COVID pandemic, and achieving funding increases for key federal public health programs. Prior to coming to ASPPH, Tim was the Vice Provost for Research, Government Affairs, and Strategic Partnerships for Northeastern University's Global Research Network. So he knows a little something about how universities operate. He served as the university's liaison to lawmakers and regulators, including research funding agencies from which Northeastern faculty receive grants. This included identifying large funding opportunities and developing teams to pursue such funding. He also worked with Northeastern's Global Campus Network in the US, Canada, and the United Kingdom to enable research funding. He assisted the university's internal constituencies, colleges, institutes, centers, faculty, students, and staff to facilitate the relationships with policymakers. That included public policy development and advocating on the university's behalf on significant research issues. Tim represented the university on the Science Coalition, Science Coalition, the New England Council, the Coalition for National Science Funding, the Ad Hoc Group for Medical Research, and the Coalition for National Security Research Funding. Tim joined Northeastern in 2010 from Brown University, not to be confused with the Brown School here. But at Brown University, he was the Director of Government Relations and Community Affairs. While at Brown, he worked to enhance the university's interactions with elected officials, grow federal funding, developed public-private partnerships, and strengthened faculty's interactions with funding agencies. Before Brown, he served as the branch chief and senior policy analyst in the Policy and Program Analysis branch of the National Human Genome Research Institute at the National Institutes of Health. He served as the liaison to Capitol Hill and other agencies. The Human Genome Project was completed during his tenure, and he also served as the Director of Public Policy for the American Society for Cell Biology, where he co-founded the Coalition for the Advancement of Medical Research, which advocates for federal funding for stem cell research. He also worked for Duke University and the John F. Kennedy School of Government. He graduated from Vassar College and received a Master of Public Administration from the University of North Carolina, Chapel Hill. And I think we might as well just go ahead and give him an honorary Master of Public Health while he's here. What do you think? So with that, please help me welcome Tim Leshan, who's here to talk to us about why public health is so critical for democracy.
Thank you so much. Angela, thank you for that very detailed introduction. I appreciate it. You have see my whole resume. You can see it on LinkedIn if you want. So it's really a pleasure to be here. And I want to thank Angela and Jonesy for making it possible for me to be here today. And Rodrigo, even though he didn't go running with me this morning, I'm teasing you, Rodrigo. He's my good friend and colleague who I've been working with since I came to ASPPH a few years ago. So we're going to talk about the critical link between public health and democracy. And I want to, there's one other thing I want to tell you all. You are going to be getting a great dean of public health in Sandro Galea. He is our former board chair for ASPPH, and he cares a lot about public policy. And so I've worked a lot with him, especially on gun violence prevention. So I just want to give you that shout out. Let's see. What am I? Oh, here we go. Never mind. I'm just being slow. Okay. I want to start off by asking you all a question and hope some people be willing to speak up. And you should also be thinking of questions because we'll have plenty of time to talk at the end. What is your why? Why are you interested in public health? Why did you get into the field of public health? Anybody want to offer up the reason why? Yes, please.
The idea of having an effect on a lot of people rather than taking a more clinical medicine approach of curing blood.
Yeah, exactly. It's not just about healthcare. It's not just about individual diseases. It's about helping everyone be healthy across the board. Any students want to venture why they came to School of Public Health? Well, I think that when you pick public health, you're truly trying to make a meaningful impact. It's a career. It's a way to shift the world's thinking on things. It's about fairness. It's about taking care of people who don't have access to healthcare. It also means it's about having a channel for advocacy. And I'm going to make the case that you all should become advocates. It's also about civic engagement. It's about helping your society, right? Now, what's my why? I'll give you a bit of a sense. You've heard about my career, so I won't get into the details, but I'll just give you a sense of why I'm so focused on public health and why I'm so passionate about it. So on the far left is a picture of me and my mom. My mom is almost 88, and she's still out there campaigning for candidates. She's the one who took me to knock on doors for campaigns when I was very little. And sometimes the door would get slammed in our face, and sometimes we get to go in and talk about a candidate. She also worked at the polls every year. She was there to make sure that the ballots are being counted appropriately and just help working the polls and help people vote. And I'd go with her. Now, yeah, there were donuts there, so that helped. But also, it just made me passionate about politics and public policy. And I remember very clearly, I must have been like 8 years old thinking that I could go there with my mom. And I asked her, can I tell people how I think they should vote? And she's like, no, that's the one thing you definitely can't do if you're working at the poll. But she would take me to the voting booth and really taught me the importance of voting. And so I have voted every chance I can. And we'll talk more about that. The middle picture is a picture of my older sister. Now, unfortunately, Erica passed away at age 44. But she battled cancer for 16 years, had 3 bone marrow transplants, really had a valiant fight. Luckily, she had a daughter who's doing very well, and a husband. You know, they sort of dealt with all of that. But Erica was my motivation to get into the field of biomedical research and public policy, because I thought, well, maybe there's something I can do that would impact public health, would impact health, that could benefit Erica. Well, sadly, I sort of figured out that it takes a little longer for these kind of breakthroughs to happen. But I was able to work, as you heard, on the stem cell issue. I don't know if many of you remember this, but there was a big effort when they discovered embryonic stem cells to try to ban that research and try to ban that technology because it became associated with an abortion issue. And so I led with others, a coalition to prevent Congress from banning embryonic stem cell research. Now, I was hoping that if embryonic stem cell research could move forward, we could come up with a cure for Erica. That didn't happen, but now we're seeing the fruits of that research, and we really are going to see a huge impact of embryonic stem cell research, all because of people getting involved and being advocates on behalf of that research, which frankly was about to go away. Now, the last picture is me on Capitol Hill with a bunch of our advocates. Now, when I'm on Capitol Hill advocating for you all, for your programs, for all the programs we have at ASPPH, it doesn't feel like work. Now, I shouldn't really say that to a constituent here, but I feel like I'm doing what I was put on this planet to do, and that is advocate for programs that will benefit our schools and programs, but more importantly, public health at the local and state level, and at the federal level for that matter. So here we are with the woman with the blue hair, who I love, is Rosa DeLauro. She is the ranking minority member of the Appropriations Committee. And the Appropriations Committee is the committee that determines all the funding for the federal government every year. Now, if the House flips and Democrats become in control of the House, she'd become the chairperson of the committee. So therefore, she will be in charge of all the budgets, including NIH, CDC, HRSA, all the agencies that are public health agencies. And she happens to be our biggest champion, not just ours, I mean public health's biggest champion on Capitol Hill. So we're very fortunate to have her. And here we are with our lobbyist, with a student next to her, with Mike Schoenfeld from Yale, because he's a constituent, and Boris Lushniak, who's the chair of our advocacy committee. And on the far right is Bita Razuli, who's the director of advocacy for our association. And I work very closely with her on advocacy issues. But so I'm motivated by my family, and then I get to do something that I love. And I highly recommend trying to find a job that you love to go to work for every day, because it really will make it a lot easier to go to work. Okay, why is public health critical for democracy? I'm going to argue that public health is the backbone of democracy, actually. You can't have a democracy without public health. It's an essential value. It's critical to our humanity, critical to peace and fairness and equity. Those values are crucial to democracies around the world. There's been research in the British Medical Journal, published in the British Medical Journal, that has shown that people who live in democracies are healthier. And we've seen the fruits of public health, but oftentimes they're invisible. For instance, in 1900, 30% of the people who died were children under the age of 5. By 1999, it was 1.4%. Now, that was because of public health measures being put in place, but it's kind of invisible, right? It's better water, better access to vaccines, access to penicillin, all those kinds of things are public health measures, but people don't really realize the impact that they've had. Things like adding folic acid to making sure that people who are pregnant take folic acid in order to prevent birth defects, and cleaning up our water. All of that helps our public health, but it's sort of invisible. But unfortunately, I think that public health is at a bit of an inflection point right now in the US. There are things that we take for granted in public health, such as vaccinations, maternal health, clean air. But those ideas have become radical to some people, the idea of having those things. These public health measures hang in the balance right now, as does our democracy. We need to make sure that we're doing everything we can to enable public health to continue to move forward and make an impact. Now, one of the most exciting or sort of fascinating examples of public health working was actually in the Gaza war. There was a shutdown of the war for a few days so that all the children could get vaccinated for polio. That was a major public health breakthrough to prevent a catastrophe because there was one case of polio. And just to think of that, we shut down, nothing else is shutting down this awful war, but that did. And think about it. What would happen in the US if that happened? How many people would say, thanks, but no thanks, I don't want my kid to get the polio vaccination. I'm good, And so we got to realize that in some parts of the world, public health is just a given, but it's being questioned here in the United States in a great deal. And part of that's coming out of COVID, right? So a recent example of that is just, this idea of how we can make things political that really shouldn't be political, and that is public health in general. So democracy supports public health. It is also the cornerstone of a free society. Clean water, access to affordable health care, prevention of disease and injury are all given are not all given in our world. They require money, dedication, public support, which means that public health is political at its core. Make no mistake, public health is inherently political because we don't have to invest in public health, but we choose to, right? Therefore, it requires you to be engaged, and it requires all of us to make sure that we advance public health, and it's critical for our democracy. So let me tell you a little bit about our association. We represent the schools and programs across the country and across the world. We have 152 members. I, as you heard in my introduction, focus on public policy and communications for our association, but we are definitely thinking about our global impact. And right now we're thinking about one of our schools, the University in Beirut, Lebanon, which is really feeling the impact of this war. So, we're really worried about them and want to make sure that they're protected in all of this as well. So now let me talk a little bit about our policy priorities. I'm sorry that's a bit of an eye chart, but I'll tell you why we have all this up here. So we start out with looking at the last few years of the federal budget related to federal programs like the NIH, CDC, HRSA, ARC, and even the State Department. And the budget was flat, basically, last year. We're now in the process of the Congress trying to finalize fiscal year 2025's appropriations, their funding. Remember, I mentioned Rosa DeLauro, who's on the committee that's making these decisions. They're trying to finalize the federal budget, which they should have done by now, but they will finish it, they hope, by Christmas time. And you can see that we really have very ambitious goals when it comes to what we're advocating for public health. And a guy named Jack Lew, who's actually currently the ambassador to Israel, but he worked in the Clinton administration, Obama administration on budgets. He said that the budget is not just a collection of numbers, but an expression of values and aspirations. And that's what we do here. ASPPH lays out what our goals are, what our aspirations are for the budget. This is the kind of investment that the federal government should make in public health if we're really going to make a huge impact for public health in the future. Now, then we face political reality, and we have the House and the Senate. These last two rows show the House version of the bill versus the Senate version of the bill. Now, the House bill, you can see, cuts almost all these programs except for the NIH, and in some cases eliminates some of the programs, like the prevention research centers, which WashU used to have one of. And the Senate, while it does much better, basically holds the budget flat. So we're now in the process of advocating very hard to make sure that these budgets at least get the Senate figure, if not more, in order to have the resources for our schools and programs and for all of you to make sure that we can advance public health going forward. Now, let's talk a little bit about the presidential election. The poll from NBC this week that came out this weekend has it dead even, right? So, and if anybody can tell you what the outcome of the election is, I've got a bridge to sell you. No one knows, right? It's incredibly close, as it has been the last few elections. So, and we're likely to see the key states that are in the margin, like Georgia and Michigan and Nevada and North Carolina and Wisconsin. They're all very, very close, and it's going to be right down to the wire. I didn't mention Pennsylvania for sure. It's going to be very close as well. And then, we have things like Robert F. Kennedy Jr.'s leaving the race and endorsing Trump, but he's still on the ballot in a lot of states. So what's that going to do to the balance of the election? And then, we have the whole issue of the economy being the #1 issue right now. And with interest rates being cut, that's a big impact. That'll have a big impact on the election. And people are very hopeful about the future of the economy, but as you just don't know, right? But we're dealing with an extremely close election here. So in the swing states, as I was starting to mention, you can see that, Arizona, Georgia, Michigan, Nevada, North Carolina, they're all extremely close as of September 23rd. And I assume that they're even closer now. So we are definitely going to be watching all of these states very carefully to see what's going to happen with the outcome of the election. Now, in the Senate, there are more Democrats than Republicans who have retired, and there are more Democrats than Republicans that are up for re-election. They traded off, so they're every 6 years, right? So not every senator comes up every 6 years. It's staggered. And so there are some very tight Senate races. Right now, the Democrats are in control of the Senate. There is a high likelihood that it could flip to being controlled by the Republicans, in part because you have people like Joe Manchin who've retired in a very red state in West Virginia. So it's likely that the Republican's going to win there. Then you have these seats in Ohio, Sherrod Brown seats, and John Tester in Montana. Those races are complete toss-up. Well, actually, John Tester is in real trouble in terms of whether or not he's going to be able to hold his seat. So it's a razor-thin margin. We could have 50-50, but with the Republicans in control. Of course, again, it matters who wins the presidential race, right? Because the vice president could be the deciding vote here as well if that happens. We've seen that with Kamala Harris. For the House, it's really amazing how many districts, because of gerrymandering and because of the way districts are formed in each state, we know that most states are, most districts are either in the red zone in the Republican side or on the Democratic side. There are only 24 districts in the whole nation of the 425 that are out there that are toss-ups right now. And that's where the balance is going to be decided. If the Democrats pick up 5 new seats, they will be in control. If the Republicans can hold off those victories, they'll be in control. It'll be extremely tight, and Congress will be very evenly divided again, and it'll be very hard for anyone to govern, no matter which party wins. So let me just talk a little bit about the consequences of each person who's running for president, what it will mean for public health. So, and we know this from documents that we've seen not just Project 2025, which you may have heard about, but from other transition documents that we've seen in terms of what their priorities are related to public health. So with the Trump Transition Project, they're talking about completely reforming the CDC and breaking it up, from, the policy piece divorced of some of the prevention piece that CDC is working on and moving some of that to the FDA. And this is in large part political because the Republicans and Donald Trump and others really did not think that the CDC handled the response to COVID well at all. And so they want to change it. They want to break it up and make it more responsive to their interests. So they're going to focus on things like conflict of interest. They believe that there are conflicts of interest in the administration of the CDC. They talk a big game about data and making sure we have data-driven decisions as opposed to what they believe were more just ideological decisions. And then they really want to focus on issues around abortion and pro-life issues and pushing that agenda. At the NIH too, they are talking about restructuring the whole NIH in terms of reducing the number of institutes at the NIH to figure out how to best position the NIH to operate differently. And because they were very frustrated with how Tony Fauci and Francis Collins ran COVID, they want to make some changes there too. The other important thing to know is that whoever wins, they're going to have to get the CDC director confirmed by the Senate. Up until now, the president has just appointed the head of the CDC, and they've found someone who shares their values and shares their beliefs, and therefore will operate very well with them. But now they're going to have to make sure that the Senate will be able to confirm that person. That's going to be a very difficult challenge because, as I said, the Senate's going to be evenly divided. So if Trump wins, he's going to have a hard time getting his person confirmed, and same if Kamala Harris wins. Therefore, we might not have a CDC director right away, and that can have a huge impact on public health. Now, for Vice President Harris, we know that she's going to pretty much follow what's been going on in the Biden-Harris administration when it comes to public health. So they're going to continue the support for affordable health care initiatives and push this advanced payment tax credit. They're going to focus on reproductive freedom. They want to focus on continuing the diversity, equity, inclusion, and justice issues in the federal agencies. They want to, of course, continue to work on opioids issues. Now, the Trump administration, if they win, they would want to do that part as well. Behavioral health, mental health, the elimination of hepatitis C. I'm just going to stop on that one for a minute. This is an effort that we've been working on for the last couple of years in Washington. President Biden put in his budget the last 2 years a program that would fund Medicare and Medicaid to get a drug that exists and develop a rapid test, which now exists, for hepatitis C, so that anybody who tested positive for hepatitis C could get the drug and take the drug for 10 to 12 weeks and be cured of hepatitis C. Now, we're trying to get this in the final funding package that I mentioned earlier for this year, but it may not happen just because of politics. So we may go into the next year. I can sort of bet that that's not going to be a big priority for the Trump administration, but it would be for the Harris administration. And this is, to me, this could be a huge public health victory. If we can have, we've done the research, we figured out what we need to do. If we can get people this drug, we can literally eliminate a disease in this country. Places like Egypt are already doing this. So then extending access for affordable childcare. And, Vice President Harris has been leading the gun violence prevention office, the new office, the first time we've had an Office of Gun Violence Prevention in the White House. And she supported the research funding for gun violence prevention. You can imagine that that's not going to be a priority for the Trump administration. All right, now I got two things I'm going to ask of all of you, those of you who are US citizens and can vote. We have started a new campaign called Voting is Public Health. And voting is a very powerful tool for driving change. And studies have shown that there is better public health outcomes in states where more people vote. Let me reiterate that. The more people that vote in a state, the more likely you're going to have better public health outcomes. So it really is, public health really is, voting, I mean, really is public health. If you believe in public health, vote in November. I'm not telling anybody how to vote. I just want to make sure that we're doing everything possible to get everybody to vote. That's our right as citizens of the United States, and it's critical, happens to be also critical for public health. And it's just good for your health. So if you go to our webpage, you can find the Public Health, Voting is Public Health Initiative, and you'll see that we focus on health policies, social determinants of health, health equity, public health funding, and environmental public health. These are all issues that when you vote, you're voting for people who are going to work on these issues, whether it's a state, local, federal level. And so you got to really try to think about voting with public health on your mind. That's the way I vote. And we're going to ask all of you who go out and vote and who encourage others to vote, and I encourage you to take people to vote, to show us your support so that we can emphasize this on our social media platforms and beyond, to really show how people are turning out to vote on behalf of public health. So we really look forward to seeing your posts. You can see the hashtag voting is public health. Please use that if you go voting, and we appreciate it. Now, the other call to action that I'm going to give to all of you is, in your career or right now, think about how you can be an active member of advocating for public health. Now, at ASPPH, we've tried to make this easy for you. We've come up with a lot of resources. We have an advocacy handbook. This is teaching you step by step how to advocate for public policy issues related to public health. We've also created a document for empowering policymakers, mostly at the state level for this one, to be advocates for public health. We need more people at the state, local, and federal level who are in office to be advocating for public health. And they only will do that if they're hearing from constituents like you all. And then we've also created what we're calling our research and partnerships agenda. This is our agenda. Remember I talked about budgets being your ambitions. This is our ambitious agenda for how the federal government should be supporting public health and academic public health in order to make an impact. That's another tool that you can use in your advocacy. Now, the thing that we just recently published is a messaging guide. Since I came to ASPPH a couple of years ago, the deans in particular, but others as well, have been asking us sort of, what are the consistent messages that we can all use to advocate and talk about public health? So we worked with all the schools and programs that are our members, especially with their communications folks, to come up with this guide, which really provides a consistent messaging. Now, in this case, now I know I'm at a university, and we frown on people taking text and plagiarizing it, right? Well, in this case, there is no plagiarism. This is free and open to the public. We hope you will take this and cut and paste this as you use it to advocate for public health. We want to make it as easy as possible. So what is in here? We talk about what is academic public health, because not everybody knows what it is. I bet when you were applying to graduate school, not everybody knew what a degree in public health was. We try to give you that language. We talk about the importance of going to an accredited school of public health and why that's important. And I know that's very important here, for sure. We talk about different pathways that students can take in their career in public health. We talk about accomplishments of academic public health, give you concrete examples of how academic public health has made an impact. We even talk about how to talk to skeptical audiences, because there definitely are skeptical audiences when it comes to public health. We give you those tools. And then we talk about some of the big priorities that ASPPH is focused on. These are our initiatives. We focus on a lot of issues, but some of them include Framing the Future, which is a new report came out last March that looks at the future of academic public health in terms of how schools and programs should be thinking about training all of you who are in schools and programs of public health. We talk about workforce development of public health, climate change, diversity, equity, inclusion, and justice, gun violence prevention. Dis and misinformation is obviously a huge topic right now, and as well as our work at the global level. And so we give you the tools of, like, this is what we're working on. These are the priorities in academic public health that people should know about. So again, I just urge you to use this guide. You can use the QR code to get to it, but you can also go to our website to see that. So I'm going to end by saying elected officials want to hear from you. Now, some of you are students, some of you are faculty and whatnot, but in your career, you should be thinking about how you make a priority to make sure that elected officials are hearing from you and about public health. It's the old adage is, if you're not at the table, you're on the menu. And so what we want to make sure is that elected officials are hearing from people who are experts in public health, not just those who may not like public health, not just those who want something else for the federal government to fund or the state or the local government to fund. We want to make sure they're hearing from you all to make sure that these priorities are considered closely. And politicians really care. They want to hear from people. People don't always realize that, but if they're hearing from their constituents, they're more likely to vote a certain way. Not always, but they're more likely to. So that's my plea. Vote and get involved in public policy. All right, Q&A. Love to hear from any of you.
If anyone has a question, we'll make sure to use these microphones so our friends online can hear it. You have a question?
I know I wasn't that perfect. Come on. Thank you.
First one started. Thanks, Tim. That was terrific. I wonder if you could talk a little bit about, this, some of the anxiety we're all feeling about the election, but for ASPPH, if you look out in a Democratic administration or even House or Senate versus Republican, what are the differences in messaging and sort of what messages might resonate regardless of the party, and what would be the different messaging and framing of some of the key public health issues that might differ depending on what happens on November 5th or 6th or 7th or 8th, or wherever we actually know the results of the election.
That's a very good point. I'll just start there for 2 seconds to say we are not going to know the outcome of this election on the 6th of November. It's going to take some time for a lot of reasons. Yeah, I mean, I always say when you're advocating for public health, you got to know your audience, right? So if you're talking to a House Republican who is somewhat skeptical, think about how public health impacts their constituents. Think about things like rural health, or how the opioid crisis is impacting their district, or how people who are getting older are managing in the current healthcare environment and whether or not they can get access. Talk to them about what they hear from their constituents in order to make sure that they can hear what your message is and that it takes resources to respond to those needs. Now, they might disagree about how many resources or how large an impact it would be, but they will be much more willing to hear you if you're talking about things that affect their constituents. And you can do that on the Democratic side as well. You should do that there too. But oftentimes you walk into certain offices and they sort of say, you know, you have us at hello, we support public health, but then you still have to give them the arguments and the impact that public health is having in your community so that they can be better advocates for the funding that's needed to make sure that public health is adequately funded and impactful as you want it to be. We're gonna be either playing a lot of offense where we're going to be really trying to push the agenda and work with the new administration and the new Congress to get even more adequate funding for public health and better public policy. But we may be playing some defense as well. And so we're prepared at ASPPH either way it goes. We're not assuming we know how it's going to happen, and we're just going to be prepared. And we always work both sides of the aisle. We are a nonpartisan organization, so we cannot focus on one. But we just know this, depending on the outcome, there's going to be a different response to it. So thanks for the question.
For those of you, for those of you online who have a question, please put it in the chat and we'll try to do a mix of in-person and online questions.
Okay, this one, yes. So the question is, how were CDC directors selected in the past?
So the CDC director was simply selected by the president. Now, of course, what happens when the president selects anybody for a major job like the CDC is he or maybe she is given a slate of candidates, of people who are really qualified for the job. And then they have to interview them and decide whether or not they're really the right fit for that administration and whether or not they think they can be successful. Part of it is, can they work with Congress? Because Congress is very skeptical of the CDC, even on the Democratic side right now. So whoever it is needs to be able to work well with Congress because they control the purse strings and the public policy of CDC. So the fact that now the president is going to have to pick someone and they have to get confirmed is, as I said, going to be very tricky to do. So. Rodrigo's got a question. Here we go.
Good.
Use my privilege of calling you my friends to put you on the spot. So democracy has been challenged across the globe. And I really love how you framed the beginning, public health is democracy. But we could argue that some public health advances have been done in non-democratic societies. You can say Cuba as one example, for instance. Vietnam during COVID, well, it's technically a democracy, but it's a very different way of calling democracy. So what are the universal values, since this is a global audience, perhaps to across the globe, that I think could resonate, regardless the governance system that we have?
Yeah.
Some societies are more, but we can call them typical Western democracies, some are sort of hybrid models. Any universal values you think we can use?
Yeah, no, thanks for that. Great question. And Rodrigo and I were part of a delegation that went to Cuba a little more than a year ago. And we really saw the incredible public health. But what happened there? The government decided that public health was a priority. They decided education was too. And so they've embedded public health. Doctors are living in the neighborhoods of people and really supporting them. We saw a doctor who had 7 women in her community who were pregnant, and she said she saw them every day. That is true public health, right? So it's about making public health a priority and the value of everyone should have access to healthcare. Everyone should have access to clean water and food and clean air. I just think in a democracy, it's a lot easier to do all those kinds of things than in places where you have less freedom, because some people might talk about the impact of public health, but not actually do much about public health. And so in democracy, there's accountability in order to make sure that everyone is taken care of. But it's by no means is democracy perfect. So.
Hello, I don't know the person asking this question, but hold up. Thank you all for your questions. Okay, so are similar selection barriers within the administrative state also applicable to the EPA and other departments that the president selects, or is this issue unique to the CDC?
Good question. It really depends on which agency as to how a person is selected, right? So for instance, the National Institutes of Health, the NIH director was recently selected, but that was simply because Dr. Francis Collins retired, and after several years of being the NIH director, they needed a new NIH director, and so therefore the Biden administration nominated the NIH director, who was confirmed in the Senate. And that, so usually what happens is that the new administration doesn't come in and pick a new NIH director, for instance. They usually stick with the same person, but they have to still work with the new administration and follow their direction. They can't just do whatever they want. But there is some concern that a new administration could come in and for political reasons replace the current NIH director. EPA, I have to admit that I don't remember, but I think it's appointed, but I don't know if they have to get confirmed or not. But it really depends on the agency. Yeah, back there. Wait for the mic.
Really, really wonderful. My question is, if we end up with an administration that is not so supportive of public health, what can all of our future leaders here in the room still be doing to help promote good public health practice?
Great question. So there are a number of things. I mean, one is continue to work at the local level to make sure that people have access to good public health and healthcare. That's going to be critical. There still will be resources at the state and the federal level to do these things, and making sure that those programs are excuse me, those programs are able to have the impact that they need to have, right? It's also really important for constituents of members of Congress, House and Senate, to continue to hear from people who think that public health is a priority. Because even if a new administration is not prioritizing public health, if members of Congress are hearing that it's a priority in their district for various reasons, they're more likely to say, no, we still need to invest in it, right? So it's really important for people. I'm sure, depending on how the election turns out, some people are going to be very disappointed in the outcome. But it's important to know that you can still have an impact and that your voice still matters. And you might be upset for a few days, but then think about, what is it that I, as an individual, can do to make an impact at the local, state, and federal level? Because you'd be surprised. We don't have enough people who are involved in advocating for the cause that they care about. And this is a cause that really shouldn't be political at all, but it has become. So we need everyone in this room and everyone who's in public health to be speaking up to make sure that we can move it forward.
Thank you, Tim. We have a student online. So I think that.
Can I ask question? Can I ask questions?
Yes, please go ahead.
Okay, thank you, Professor, for your wonderful presentation. Can you hear me? Sorry.
Yes.
Okay, thank you for your wonderful presentation. My question is like, you have mentioned about the challenge, the democratic challenge in some part of the world, like Palestine and the Middle East, because of countries' conflicts that affects people. Like you mentioned, as recently reported, there are polio, type 2 polio cases reported in Palestine after 25 years. Like this is because of like low access to the polio vaccine, mainly because of the conflict, like public health professionals and like other health professionals can't reach exactly the population, like the population in need. And we have also seen like some health
Yes.
education, like in US, there is no issue of access, but like because of like disbelief in pupils, like people are like tending not to get their childs vaccinated, like because
Excuse
of
me
like.
for interrupting, but do you have a question?
Sorry, my question is like, what is the role of like, what is the role of like the CDC, WHO, and like other as a public health specialist, what should be our role like to tackle, you know, what can we do to tackle such kind of affected pupils globally? Because I think we are in the period of globalization. So as a global citizen, how could we like address those in need, especially as a global public health specialist?
Yeah, I really appreciate you bringing up the global aspect of public health. And you're right, the CDC, WHO, even the State Department in the US, have an impact on global public health. And we want to make sure that the United States remains a member of WHO. WHO is doing incredible work on public health. My boss, Laura Magana, who's the president and CEO of our association, has been working on a major report that they just put out recently about the future of public health workforce. Everywhere in this country, in the world, people are struggling to have enough people who can work in public health. And so they're really focused on what are the tools we need to do to increase the number of people and make it easier for people to get jobs working in public health. The CDC works with countries primarily in Africa, but elsewhere as well, really focused on trying to mitigate the impact of certain diseases. And then the State Department works with the universities often and others similarly on research projects in collaboration with folks in those countries in order to try to mitigate the impact of various diseases. So it's really important for the US, to really be thinking globally, not just about the impact on the US, because we all know, we saw it in COVID, right? A disease can start somewhere else and come to the United States and have a huge negative impact on our country, and vice versa. So we need to be thinking about public health in a global perspective. So thanks for that question.
One more question from online.
Great.
How does the ASPPH address the issue of inequality in resources across member institutions? Because accredited schools have differences in terms of access to resources, and this may have impact on learning outcomes.
Yes, so I know some of you had to go to class. Good luck. So ASPPH is very focused on this. Now, we do represent the accredited schools of public health because we think it's very important for students to have the best possible public health education. But we have some members who are, have the resources, to be a member of ASPPH. There are other members who have fewer resources or smaller programs, and they pay a little less, right, to be part of ASPPH. And then we've had a big focus recently on getting more HBCUs and folks from minority serving institutions to become members of ASPPH. And that's frankly been a resource issue. So we really want that diversity of membership in order to have the broadest possible perspective on academic public health. It's very important.
One more question.
Thank you very much for the wonderful presentation. I saw in one of the slides that most of your programs was in the United States and one or two countries in Asia. How are you extending your program to other continents like Africa, Europe, and thank you.
This is great. Everybody is very not so US focused, and I appreciate that question. So we also manage a global network of associations like ours all across the globe, including Africa. There isn't one in Canada for some reason. We can never been able to figure that out. But all the, most of the regions of the world have associations that represent numbers of public policy, public health programs and schools. And so we are currently, my boss, Laura Magana, is the president of that association. It'll rotate, but she's working very closely with folks in Africa, in Asia, in Europe, and of course in the US too, but South America, in order to make sure that we are collaborating, coordinating, and everyone can learn from the expertise of everyone else, right? And, when issues have come up in various regions, whether it's war or other public health concerns, we are working very closely with those associations to make sure that we're helping them traverse those challenges. And so this is a relatively new network, but it really opens up our access to global constituencies, and we're going to be continuing to grow that. We're also, we're not there yet, but we're hoping that the first accredited school in Africa will become a member of ASPPH. Well, I don't have an announcement to make, but we'll see. We'll see if that can happen in the next year or so. One last question here.
Thank you. I wanted to ask if there is any place for private sectors to be involved in public health, because I see most of the funds are from the government and political changes can change that. So is there any parts of private sector?
Another great question, and something that we've been talking a lot more about recently in the last couple of years at ASPPH, because there are plenty of nonprofits, of foundations, of companies who are involved in public health. I'll give you just one example, and that's AWS, Amazon Web Services. It's not an ad for Amazon by any means, because I'm not necessarily a fan, but they have funded us and other public health programs all over the world because they see the need for the tools that they have to be used to advance public health. And so we've been really trying to dial in more with the corporate world, with the foundation world, and companies that are focused on health, such as CVS Health and those kind of things, in order to bring them into the fold and have them help advance our mission and frankly work to advance their mission if it's good for public health. So yeah, there's a lot more work to be done there. All right.
Thank you so much. Now, see if I was a good student. Tim had 2 assignments for us. So is that not working? Thank you.
He had 2 assignments for us. Some of them are multi-level. I'm gonna see if I can repeat those back to wrap us up. And because I'm a professor, I'm gonna add 2 more.
Boy, you're tough.
So the first is, if you can vote, if you're eligible to vote, please vote. Remember that election, November 5th, make your voting plans. And please be a participant in that process. Whoops. The second was to check out that messaging guide and use it, right? Use it in your advocacy work. And that's free and open to the public, right? So check that out, and we'll see also how we can start incorporating that into our classes as well. The 2 that I'm gonna add is continue to be those global scholars asking those great questions in preparation for how you improve the global public health workforce. And thank you for your dedication to that. And lastly, if you're still here,
It's still with me. I would love it if you could come up and take a picture with Tim.
Oh,
Thank you-
awesome. That'd be
thank you-
great.
Thank you so much, Tim. Thank you for being here. Did I
Thank
get it
you.
right? Did I get your sign?
Yeah, yeah. Thank you for being here. Appreciate it. Lose my voice from talking so much.